Gottlieb Burckhardt, Wikipedia audio. Johann Gottlieb Burckhardt was a Swiss psychiatrist and the medical director of a small mental hospital in the Swiss canton of Neuchâtel. He is commonly regarded as having performed the first modern psychosurgical operation. Born in Basel, Switzerland, he trained as doctor at the universities of Basel, Göttingen, and Berlin, receiving his medical doctorate in 1860. In the same year he took up a teaching post in the University of Basel and established a private practice in his hometown. He married in 1863, but the following year he was diagnosed with tuberculosis and gave up his practice and relocated to a region south of the Pyrenees in search of a cure. By 1866 he had made a full recovery and returned to Basel with the intention of devoting himself to the study of nervous diseases and their treatment. In 1875, he attained a post at the Waldau University Psychiatric Clinic in Bern, and from 1876 he lectured on mental diseases at the University of Bern. Beginning in this period, he published widely on his psychiatric and neurological research findings in the medical press, developing the thesis that mental illnesses had their origins in specific regions of the brain. In 1882 he was appointed the medical director of a small, modern, and privately run psychiatric clinic at Meren in the Swiss canton of Neuchâtel, where he was provided with a laboratory to continue his research. In 1888 he pioneered modern psychosurgery when he excised various brain regions from 6 psychiatric patients under his care. Aimed at relieving symptoms rather than effecting a cure, the theoretical basis of the procedure rested on his belief that psychiatric illnesses were the result of specific brain lesions. He reported the results at a Berlin medical conference in 1889, but the reception of his medical peers was decidedly negative and he was ridiculed. Burckhardt subsequently discontinued his research activities. Following the death of his wife in 1896, Burckhardt returned to Basel, where he established a sanatorium in 1900. He died 7 years later from pneumonia. Gottlieb Burckhardt was born on December 24, 1836 into a well-known family, the Burckhardt, living in the Swiss city of Basel. His father, August Burckhardt, was a physician. His mother was Katharina Jacquet from Montbéliard in France. Burckhardt's parents were married in 1833 and his mother gave birth to 7 children prior to her death in 1843. Gottlieb Burckhardt was the 3rd eldest child. In 1844 his father married Henrietta Maria Dick. She had 5 pregnancies and 3 surviving children. Burckhardt attended secondary school in Basel. His medical studies were conducted at the universities of Basel, Göttingen, and Berlin. In 1860 he was conferred with a doctorate in medicine from the University of Basel. His doctoral thesis was on the epithelium of the urinary tract. As a student, he was described as popular, outgoing, and musically talented. Early life and education. By 1860 Burckhardt had established a private medical practice in Basel. In 1862 he completed a postdoctoral habilitation in internal medicine and was granted the position of Privatdozent at the University of Basel. The following year he married Elisabeth Hüsler and they had 8 children together. In 1864, due to a diagnosis of pulmonary tuberculosis, Burckhardt was forced to give up his practice and he relocated to a southern locale near the Pyrenees. He recovered fully and published a study of climatic conditions in the region. In 1866 Burckhardt returned to Basel and resolved to study the diseases of the nervous system and their treatment with the new electrotherapies. His interest in this field had been fostered by Karl Ewald Haas, a noted physician and friend of the Burckhardt family. In 1873 he was elected to the presidency of the Basel Medical Society. 2 years later, in 1875, he received a post as a physician to the Waldau Psychiatric University Clinic in Bern. Later that year he also published Die Physiologische Diagnostik der Nervenkrankheiten, a 284-page monograph which detailed the results of his research on the use of electrotherapy for nervous disorders and the conductivity of the nervous system. In 1876 he became a Privatdozent at the University of Bern where he lectured on nervous and mental diseases. This marks a highly productive period in his career as he became a regular contributor to several medical publications including the Swiss periodical Korrespondenzblatt für Schweizer Ärzte and produced articles on a variety of psychiatric and neurological topics. In 1877 he published a historical treatment of psychiatric and psychological theories of the functional regions of the brain. In this article he proposed that there were cortical dispersion centers which were rooted in physiology and anatomy in the brain and that these played a crucial role in the development of mental illness. Burckhardt drew inspiration for his hypothesis from recent advances which had shown the localization of language faculties in the brain, and he believed that mental diseases were also traceable to specific cortical centers. In the application of internal medicine to psychiatry, his research activities extended to an exploration of the relationship between mental illness and bodily temperature, blood pressure, and pulse. In 1881 he published on the relationship between cerebral blood flow and oxygen consumption and posited a connection between cerebral oxygen deprivation, pathological brain circulation and mental illness. While at Bern he also successfully submitted articles on the histological preparation of brain cells, sensory aphasia, the anatomy of the brain and cerebral localization and forensic psychiatry. From 1881 until his departure from the Waldau Clinic in 1882, Eugen Bleuler, who coined the term schizophrenia in 1908, served as his medical intern. In August 1882 Burckhardt was appointed as the medical director of the Prefargier, a small but modern psychiatric clinic in Maren in the Swiss canton of Neuchâtel. Prior to his arrival a laboratory was constructed at the clinic so that Burckhardt could continue his research into neuroanatomy and psychophysiology. In February 1884 he presented at the Prefargier Asylum his findings on the heredity and the surface configuration of the brain. He continued to publish on psychiatric and neurological topics such as cerebral vascular movements, brain tumors, and optic chiasm, traumatic hysteria, and writing disorders. In December 1888 Burckhardt, who had little experience of surgery, performed what are commonly regarded as the first series of modern psychosurgical operations. He operated on 6 patients under his care, 2 women and 4 men aged between 26 and 51 whose condition was deemed to be intractable. Their diagnoses were, variously, 1 of chronic mania, 1 of primary dementia and 4 of primary Verrücktheit. This latter diagnosis was, according to the clinician historian German E. Berrios, a clinical category that should be considered as tantamount to schizophrenia. Burckhardt's case notes recorded that the patients all exhibited serious psychiatric symptoms such as auditory hallucinations, paranoid delusions, aggression, excitement, and violence. The operations excised regions of the cerebral cortex, specifically removing sections of the frontal, temporal, and tempoparietal lobes. The results were not overly encouraging, as one patient died 5 days after the operation after experiencing epileptic convulsions, one improved but later committed suicide, another 2 showed no change, and the last 2 patients became quieter. Complications consequent to the procedure included epilepsy, motor weakness, word deafness and sensory aphasia. Only 2 patients are recorded as having no complications. The theoretical basis of Burckhardt's action rested on 3 propositions. The first was that mental illness had a physical basis and that disordered minds were merely a reflection of disordered brains. Next, the associationist viewpoint of nerve functioning, which conceived the nervous system as operating according to the following threefold division of labor: an input system, a connecting system which processed information, and an output system. The final assumption of Burckhardt's was that the brain was modular, which meant that each mental module or mental faculty could be linked to a specific location in the brain. In accordance with such a viewpoint, Burckhardt postulated that lesions in specific areas of the brain might impact behavior in a specific manner. In other words, he thought that by cutting the connecting system, or second association state of brain's system of communication, troubling symptoms might be alleviated without compromising either the nervous system's input or output systems. The procedure was aimed at relieving symptoms, not at curing a given mental disease. Thus, he wrote in 1891, excitation and impulsive behavior are due to the fact that from the sensory surfaces excitations abnormal in quality, quantity, and intensity do arise, and do act on the motor surfaces. Then an improvement could be obtained by creating an obstacle between the 2 surfaces. The extirpation of the motor or the sensory zone would expose us to the risk of grave functional disturbances and to technical difficulties. It would be more advantageous to practice the excision of a strip of cortex behind and on both sides of the motor zone, creating thus a kind of ditch in the temporal lobe. Burckhardt attended the Berlin Medical Conference of 1889, which was also attended by such heavyweight psychiatrists as Victor Horsley, Valentin Magnin, and Emil Kraepelin, and presented a paper on his brain operations. While his findings were subsequently widely reported in the psychiatric literature, the reviews were unremittingly negative, and there was much ill-ease generated by the surgical procedures he had performed. He also published the results of the procedure in 1891 in the periodical Allgemeine Zeitschrift für Psychiatrie und Psychische Gerichtliche Medizin in an article entitled Über Röntgenexcisionen, als Beitrag zur operativen Therapie der Psychosen. This paper was his last significant medical publication. Kraepelin, writing in 1893, was scathing of Burckhardt's attempts, and stated that he suggested that restless patients could be pacified by scratching away the cerebral cortex. While Giuseppe Seppilli, an Italian professor of neuropsychiatry, remarked in 1891 that Burckhardt's view of the brain as modular did not fit in well with the view held by most that the psychoses reflect a diffuse pathology of the cerebral cortex and the conception of the psyche as a unitary entity. Burckhardt wrote in 1891 that doctors are different by nature. One kind adheres to the old principle, first, do no harm. The other one says, it is better to do something than do nothing. I certainly belong to the second category. The French psychiatrist Armand Semelane responded that an absence of treatment was better than a bad treatment. After the publication of his impressive 81-page monograph on the subject in 1891, Burckhardt ended his research and practice of psychosurgery due to the ridicule he received from his colleagues over the methods he had employed. Career. Commenting on his monograph in 1891, the British psychiatrist William Ireland concluded, Dr. Burckhardt has a firm faith in the view that the mind is made up of a number of faculties, holding their seats in distinct portions of the brain. Where excess or irregularity of function occurs, he seeks to check it by ablation of a portion of the irritated centers. He defends himself from the criticisms which are sure to be directed against his bold treatment by showing the desperate character of the prognosis of the patients upon whom the operations were performed. Ireland doubted that any English psychiatrist would have the hardihood to follow the path taken by Burckhardt. Following the death of his wife and one of his sons, Burckhardt left his position at the Prefecture in 1896 and returned to Basel with the intention of setting up a sanatorium. This plan came to fruition in 1900 when the Sonnenwald Clinic was opened in Rehen near Basel. Burckhardt served as the clinic's medical director from 1900 until 1904, and he remained a physician at the facility until his death from pneumonia on February 6, 1907. He was a marginal figure within the professional community of his psychiatric peers, attending few medical symposia and conferences in his discipline. However, he is often seen as a precursor to the Portuguese neurologist, Egas Moniz, who performed the first leucotomy, later known as lobotomy, in 1936. Early career, 1860–1888. Psychosurgery, 1888–1891. Later career and death, 1891–1907. Publications. Notes and references. Notes. Footnotes. Bibliography. Online sources.